So just a few moments ago, we were looking at the axial plane here. Now what we're going to do is we're going to rotate this probe 90 degrees. All right, so now we've got 90 degrees here. And if we look at the image on the right-hand side, we go from axial view of that spinous process to sagittal view of the spinous process there. So I'm also going to demonstrate here differences in probes and frequency, stuff like that. All right, here's our bony cartoon right there of where that probe is now coming across longitudinally across those spinous processes. Okay, so here we are. Linear at 12 hertz versus, or 12 megahertz versus 8 megahertz, right? So this side we got 12 megahertz. This side we got 8 megahertz. Linear probe in both cases. We tend to think that with a higher resolution linear probe, we'll need that for more superficial structures, right? But it depends on what's in the way, what's in between your probe and your structure of interest. In this case, because we have the aforementioned interspinous and supraspinous ligaments, those ligaments are quite thick and strong and dense. And because of that, there's going to be some beam scatter through that ligamentous structure. And so if you're using a higher resolution or higher frequency, rather, linear probe in that lumbar spine area, you get that beam scatter. You can't really see the bony surfaces that well. If you drop your frequency some, you get better penetration here. Now we're going to compare linear versus curvilinear here. So now we take the same image here, and we're going to move it to the left. And then on the right-hand side, now we've got a curvilinear probe. How do we know? You look at the top, and the top is curved, whereas here it's straight, right? So here again, decent penetration, but look how much better the penetration is on that curvilinear probe, right? So that gives you some idea of what can be useful and helpful in terms of your visualization. All right, so coming back to our previous image here, so we're in midline here, right? Now, what I'm going to do is we're going to start sliding to the left here. You can see this arrow moving from one structure to the next, going medial to lateral. So here we got our spinous processes. Pay attention to our depth. In this case, it's about 1¼ centimeters or so to the top of the spinous process. Okay. Now we go laterally to the inferior articular process. In this case, it's going to be the L3 inferior articular process, which is more medial, right? And then the next one is the L4 superior articular process. So inferior articular process is medial, superior articular process is lateral. Now we look at the ultrasound image. I'm going to go back to this one here. Spinous process, look at how superficial it is. Articular process is definitely deeper, about 4 centimeters. Then the superior articular process is a little bit more superficial, right? So if I go back and forth between these two, you can kind of see the difference between inferior and superior articular processes. You see that as we're kind of going sagittally or long axis across that facet joint, right?